All right, so we're talking today about bone-on-bone pain, sharp shooting, stabbing, burning pain, grinding pain, herniations, the pain that typically we think there's nothing that can be done for it.
Right.
Jade and I were working on many patients like that. Which patient stood out to you, Jade?
There's a few in particular, but the one that I want to speak about most is she had a knee replacement. And it's significant to me because many times when people have a knee replacement, they think, well, physical therapy is the best that I can do, and I'll just do whatever the doctor says, and the knee is going to be the knee. You know, it is what it is. After a knee replacement, what else can be done? And she showed significant improvement after, one session of wet cupping. And when I was in with you and we were treating her, it might have been her second session, and she came in. She was having noticeable difficulty getting up out of a seated position. She was having difficulty walking. She came in with a noticeable limp in her gait. And after the wet cupping, we tested out, and she's feeling great. I mean, she wanted to say, what did she say, 50% or 30%? But
yeah. So let's just go in a little bit more detail and background on that one specific case. 55-year-old woman about. She had, knee construction or?
Knee replacement.
She had a full knee replacement, right?
Yeah.
The scar was completely healed up,
Yep.
So she was a couple weeks out. Prior to the knee replacement, she was having the burning, grinding pain in the knee. Activity really made it worse.
Absolutely.
She would have to sit down a lot. There was even heat to the knee, like inflammation,
Yes.
so she could touch her knee. There was swelling, there was heat. She didn't get to us at that point because we could have helped her at least manage the pain very significantly.
Right.
But ultimately, because the damage was so extensive, she would have needed that knee replacement.
Yeah.
There's always a time and a place for surgery, knee replacements. Sometimes you can push them back or not need them for many, many more years, or sometimes people cancel them after they
Right.
seek alternative options. But of course, there are many people who need those replacements. There's such extensive damage done that they're at a point where that is their only option.
Right.
And that any provider needs to support that option as well. So she got to us, and she was still having pain in the same spot, even though her knee was replaced.
Right.
And so that's kind of ironic, but we hear that sometimes, that it didn't quite resolve, or maybe now it's a new pain, but in the same spot.
Exactly.
So what we did was a wet cupping technique where we lanced and we pierced the area first. And a lot of us are familiar with cupping from the Olympics, Michael Phelps,
Yeah.
where it produces those circular bruises and stuff like that. Well, that purple, that dark stuff that's pulled up to the surface, with wet cupping, we actually drain it out.
That's right.
These dark fluids and stuff come out through the holes. And in fact, you don't have any of that discoloration on the skin. What that does is it brings fresh oxygenated blood into that joint, resolving inflammation, pain, and soreness, and swelling in the area.
Yeah. She responded great to it. And we did maybe 2 or 3 zones, or even, I think maybe even 4 zones. And
It was very significant.
It was significant. And she, they don't experience any discomfort during the treatment. They don't even notice a difference in the treatment until they get up and they actually test those pain areas, and they're surprised at, the improvement that they're experiencing.
We were actually concerned that how much we were going to be able to help her,
Right.
because she came in with such a severe limp
Yes.
as she was walking every step, and even her knee bowed in.
Yes.
And when we see such significant structural problems, worse with movement, the knees bowed in, it's like, she's here, so let's see what kind of results we can get for her in 1 or 2 treatments, right? To see if we want to go further or not.
Right.
We're always looking to show some sort of progress in 1 to 2 treatments, not months, not weeks, right away.
Right.
Even if it's 3 or 10%, yes, then this is a therapy you should get. And now I know we can get 40, 50% in a couple more visits.
Yeah.
And even though our goal might be 70, 80%, this is a good therapy.
Yeah.
But just mention, we were testing her standing, sitting. Just mention how.
Yeah, I was just going to get into that.
Uh-huh.
I remember when she first came in, she kept saying how it was getting even to the point where her shoulder was starting to give her pain because she was using her arm so much to get up, and she felt like she couldn't get up unassisted. She's like, I'm too young for this. I shouldn't be going through this.
Yeah.
And by the end of the treatment, we had her tested again, and she was still able to, she still had to use the arm a little bit, but significantly less, to the point that, she didn't really have to use her whole force, her shoulder, her whole upper body strength to get up out of the seated position. It was a low seated chair, and she was able to get up, and the improvement was significant.
She stated that really sharp pain,
Yes.
which kind of made her hesitate to get up.
Yes, grimace even. She was saying, she's like I even have to, she's like, it was to the point I have to yell a little bit to get up.
Mm-hmm.
And when she was doing it, she's like, she couldn't believe it.
Like the extreme intensity was taken away. There was still pain after the treatment, but that extreme sharpness, that extreme intensity really was much lower. She was very surprised by it.
Yeah, she was definitely happier and surprised, and just the pain just completely shifted. She definitely, it's just amazing because when they, like I said, when they have the knee replacement, they don't expect much. They don't know what the therapy is uncomfortable. They're going to physical therapy. They're doing other things, and it's always uncomfortable with the knee replacement recovery.
Yeah.
So it was just great to give her that response, and she just, I'm just glad to be a part of it. It was like a great experience for her. It's amazing to see.
It's a really great, amazing
see,
story, but we see
witness.
that common with the knee. We just touched upon knee, extreme pain in the knee, which we can help. But let's move on to the other grinding and bone on bone. Let's talk about herniated discs. Like what is that? What's grinding? And what is the pain that they're feeling?
Right. So when someone's dealing with herniated discs, you have the spinous processes that are closer together. They're getting constricted. They're feeling this restricted motion with whether they're trying to twist or just, anything. They're almost with every motion, when the spine is in any type of disharmony or pain, almost every motion will activate it, and they'll feel it throughout the day. And what we've seen, especially when a client or patient comes in and they're dealing with this bone-on-bone pain, they're dealing with these compressed discs. They're not expecting much. They've been dealing with it sometimes for years on end, and with no relief, with no options. And we've tried this wet cupping. We've doing the wet cupping for them. It's bringing in the oxygenated blood, and they're having great responses, and it's amazing.
But let's talk more about the two. We have different bones in the spine that come down, and in between each bone there's a cushion.
Yeah.
Right. Some people describe it as a jelly donut.
Yeah.
Because there's fluid in the middle of that cushion that when it leaks out, it creates burning sensations like a hot poker, or even tingling down the spine, or even like fire down the side. A combination. Sometimes it might be also confused with sciatica.
Right.
It can bring on sciatica as well. Sometimes it could be all over pain, and sometimes it can be just pinching pain
down the arms,
in the spine or the lower back area, and it really inhibits motion. And they go to the doctor, the orthopedist, the surgeon. They get MRIs, X-rays, and the doctor says, it's bone on bone. There's no cushion left, or there's not much left there.
Your only option is surgery.
You need to get surgery, and people are like, I'm not that old, and to get a spinal fusion, to get a cage put in, or now they're even doing artificial discs.
Yes.
And all these things could be good options, and maybe it has to be the ultimate option. But what we're seeing is that after wet cupping, that it's relieving 50, 60, 70, 80% of these extreme signs.
Right.
And these people are now living just a normal life.
Getting
and
their lives back.
They're
really
pushing back that surgical procedure, and their surgeons want them to. Your doctor, your surgeon will tell you, only when this is necessary, you should get it done. When you really are in extreme pain 24/7, you can't sleep, you can't do normal daily activities, then a lot of surgeons now are not just pushing you to get into surgery. Is what I'm hearing from a lot of patients. They're like, wait till it's really bad, or yes, it's really bad. Do you want to do it now because of the pain level? It's usually based on pain level.
Right.
And they're telling you the reason why, which is it's bone on bone. So do you want to try shots instead? Have you met a lot of patients who've
Oh
tried
yeah.
shots?
Oh my God. So many. Everyone. I mean, cortisone shots for the feet, for the back. I mean, for
Mm-hmm.
the thing with the cortisone shot is it's not permanent. Some people respond well. Some people don't respond at all, and you can only get for so many before they recommend you surgery. So we do get a lot in here. People that have got the shot, they respond well, but it's still not the lasting benefit that they're looking for, and mainly it's because it's not treating the root issue. It's not bringing in that
It's a
oxygen.
Band-Aid.
Yeah, it's a band-aid fix. We're not. It's not addressing the root. Or making any physical change. It's just really numbing this area for you, so it's not going to bother you or distract you as much. You can get on with your day, but the issue is still there.
We really believe in all medicine. We believe in
It's good
surgery,
medicine, yeah.
shots, everything. There's a time and a place. What I'm really seeing, though, with the cortisone shots, with the bovine shots, with the cocktail shots,
Yes.
what I'm seeing is that they're very hit or miss.
Right.
Sometimes it's some pain relief. Other times they're told, it could take 2 weeks for it to work. I haven't really heard feedback from patients, I hit the 14th day and now it's a miracle.
Right.
I'm really finding yes, it worked in the first couple days,
Exactly.
or it didn't work. And I'm like, okay, so it worked for you. Great. I'm glad you're out of
Absolutely.
pain. Like,
Yeah.
how long did that pain relief last for you? Well, it felt really good the first week, and now the pain is really coming back, and now it's like only helping me like 30%.
Right.
And I can only get 3 a year in that spot because cortisone eats away at your bones. So if you're in emergency room level pain, cortisone's fantastic.
Absolutely.
But if it's not lasting, if it's not giving you 3-4 months of really good pain relief, your doctor's probably going to tell you that you're going to need to manage it a different way, or
Right.
go the surgical route.
That's right.
And I think you're finding that as well.
Yeah. I mean, people don't want to have to keep going back for shots.
Mm-hmm.
If they can have an alternative option, of course they want to explore that, but sometimes people just don't know what else is out there. I think wet cupping is a great option because we're seeing noticeable, significant improvement in 1 or 2 treatments. It's amazing.
Now I know we're using the term wet cupping a lot, and I know a lot of people, for the majority, don't know what that is. And your first instinct might be, let's Google it.
Right.
Now, and that's fine. Watch YouTube, see a video, but just remember, it's going to look a lot more dramatic
Absolutely.
than it actually is. It's a
Yeah.
very painless procedure. You might feel a little tiny pinch, but it's really nothing how it looks.
Honestly, most patients are saying they're not feeling anything at all.
They don't even know that we're doing
They
it.
don't even know. They don't know, but they experience the lasting benefits, so it's amazing. They're not saying they're in any kind of significant pain when we're prepping, when they're receiving the treatment. It's not painful. In my experience with the patients that I've dealt with, it's what they remember most is the improvement.
And it's immediate.
Yeah, it's immediate.
And like I said, the majority of our patients, in 5 minutes,
Yeah.
they have significant pain reduction,
Right.
range of motion. We have this one gentleman who's, I think he's in his late 50s, and he has a truck route and he has to move a lot of
Yes,
things, right?
yes.
Talk a little bit about that patient.
Well, his issue when he came in, he literally was wearing 3 knee braces.
Yes.
He had 3 knee braces on, and he said, he works the overnight, so that's rough anyway. So he's working the overnight, and he's up and down the truck as he does deliveries. He's up and down the stairs of the truck. He's up and down all night, moving stuff and everything. So he comes in at the end of his shift. He's exhausted. He's got the knee braces. He's all messed up. He can barely walk. He's limping, noticeable limp. And he's like, do what you can. He was ready. He was prepared. He was interested. And after, I think maybe 10 minutes after the wet cupping, we got him up, tested it again. I mean, if I got up, you wouldn't be able to see, but I'd speak about this case because when he came in, we said, we tested the knee, we tested his gait. Can you lift your knee? He maybe lifted it maybe 3-4 inches off the floor. After the wet cupping, his knee was above his waist.
He kept saying how he didn't feel the pressure.
Yeah, he's like, the pressure's relieved. He's like, oh, no, it's great. It's great. That's all he kept saying. It's great. I mean, they don't expect the improvement, and it's just a wonderful thing to be able to provide that.
And we're gonna definitely gonna provide a small video of some
Yeah.
wet cupping, but text us, email us, anything. I know wet cupping is a new therapy
Yes.
that you may have heard of, but it's extremely safe and very effective.
Absolutely.
All right.
Great.